Okay, thank you, everybody. This work was done over the past 3 years, and Dr. David Warrell was also involved with us in this project. This is the first study that reveals both the epidemiological as well as the clinical symptoms associated with snake bites. I'm not an MD, but my brother, Samir, he is an MD, he's a pathologist, as well as Dr. David, and both they helped us to construct the clinical part of the study. You click, how do you do that? Oh, this is the pointer, okay. As most of our colleagues talk about snake bites, especially in the Middle East, as well as in Africa and elsewhere, it's a big problem with about 5.5 million people every year are being bitten, and the fatalities can go up to 100,000. I like it yesterday when one of our colleagues talked about the subsequences of snake bites. It's just not only the trauma, it's also the various physical suffering as well as the psychological effects that will affect the patient. Interest in snake bites in Jordan in particular goes back for more than 50 years or so, with just recording the number of cases and the number of fatalities related to snake bites. So I remember when I was still in my 4th year in the university, we published a paper, the first paper in details about the epidemiology of snake bites in 1983. Others followed, and when I came back home to Jordan, I quickly start to make connections with the Ministry of Health and others in order to obtain as much data as possible about snake bites. So in Jordan, we have 36 species of snakes. Of these 36 species, we can say that 7 are considered venomous. Some of the snakes are very nice looking, as you can see, and these are non-venomous, all of these, what you can see here. But when it comes to the venomous species, the 7 venomous species, they vary. We have the Palestine viper, we have the saw-scaled viper, Echis coloratus, we have, as I will show you in a second, oh, no, not yet. The Macrovibera libatina, it's not the obtusa. When our colleague from Armenia talk about Libatina obtusa. And then we have the Arabian horned snake, Cerassus gaspereti, and we have also, what else? We have the Echis, we have the Palestine viper. Then in the desert, in the eastern desert of Jordan, between Iraq and Jordan, we have a species adapted to live among the black lava desert rocky area, and this is Pseudocerassus fildi. Then we have the Egyptian cobra, Alternigia aegyptia, and then this one here, this is the mole viper. This is Atrachaspis ingidensis. Maybe many of you, you don't know Jordan very much. In Jordan, we have, it is a small country. It's 100,000 square kilometers, but it enjoys a variety of habitats. We have pine forests in the north, you have oak forests, and then as you go east, you start to see the different types of desert. This is a black lava desert. This is in the south. It's mostly sandstone mountains. And then as you keep going south, as well as to the east, you will see different types of habitats. This is also in the eastern desert. Also, as well, you can see oases in the middle of the desert. This is the Wadi Araba area, where you can see the African influence with the, even with the snakes, as well as the vegetation cover. This is the outstanding Wadi Rum area, and it's all sand desert with sandstone mountains. So this creates a variety of habitats for different kinds of snakes, including the venomous forms. So this is the map of Jordan. This is here, you have a series of mountains, the eastern mountains. In the eastern mountains, where you have most of the forests here, you can see the Palestine viper. At the edges of these forests going to the Jordan Valley, you will start to see the Ecus coloratus. And then here, in particular here, there's a relict population. It's only restricted in this area for the Macrovipera libatinus. And then again, along the Jordan Valley, Wadi Araba, if you, up to here, you can find the Atrachaspis engidensis. Also, this is an African species that penetrated through the Rift Valley, reaching as far as about this area here. To the east, as I told you, here, this is the Black Lava Deserts. It's all volcanoes with black boulders, huge ones. And then you have the Pseudocerasus fildi, where you have sand in Wadi Araba or around here, you have the Arabian horned viper. In this study, and this I have a very big problem convincing the editor of the journal about the sample that we studied. We have 121 cases of victims who came to the either the emergency room or to the main hospitals where they were admitted. This is over what? This is between June 2018 to September 2020. Other cases that maybe they went to tertiary clinics or even private clinics or whatever, they are not included. An average of 500 cases of snake bites can be seen in Jordan every year and so on. Here, what happened, we selected the patients, only those who attended the emergency rooms or they have to stay in the hospital. Again, we have the same problem in using the right antivenom. One of our friends yesterday, he talked about that in Ethiopia, they are using the Egyptian antivenom. Here, we have the same problem. All the hospitals, whether it is the Ministry of Health or the Armed Forces, we have two categories of hospitals. Hospitals that are governmental hospitals, and then for the army, they have their own hospitals, they have their own clinics. And both, they are using the an Indian antivenom produced by Vins, by Biosnake. Okay. Now, let's look about the distribution of cases. So out of this 121 cases, we can see that most of the cases, they are from the north, the extreme north, where you have mountains, you have rocky areas, you have forests, okay? And most of the people in this area here, they are engaged in agriculture. So it is sort of occupational hazard that is facing the people. And then as you go south around also Karak area, here we have agriculture. Also, you have high number of cases. Look at this here. This is the biggest governorate in Jordan, Man. It's almost half the country, and you have only 4 cases. First, this is mostly, it is a desert, and the population, it is the lowest populated area in Jordan, but it is the biggest area in Jordan in terms of area. So we have only 4 cases. As you go to the east, so you have only from this area, you have just 1 cases, 2 cases. So most of the cases are along the mountain range. These data were collected from 24 hospitals. Now, when we talk about the sex ratio, it was about 3.2 males to 1 female. The over age median was 26.5. And here, this can give you more elaboration about the age groups as well as the gender. So you can see most of the cases, they are between over 10 to 30 years old. Many of these people, they are engaged in one form or other related to field activities. Either they are involved in agriculture or similar forms. Now, what is so nice about this study also, that I will just jump here, okay, here. About 80% of the patients, they brought along with them the snake that bit them to the hospital, okay? And this is where's my turn to identify the snake, either as an image or they have it preserved. So we have here, as you can see, the seasonality of snake bites along with the snake that bit the patients. We will see that Icus coloratus was the main snake that caused the bites all over the period of the study. This table shows here for each species, the poem of Palestina. You have how many in total? You have 19 cases. We don't have any fatalities, but when it comes to the Icus coloratus, it has the highest 68 with 6 fatalities. Walternegia, no fatalities, 2 cases. Atrac aspis, 4, no fatalities. Libatinas, we have just came up with 1 case only. Pseudoceratops persicus fildi, only 2 cases, also no fatalities. And then we have the unidentified snakes. The patients did not bring the snake and they did not recognize it. We have 25, but we have 2 fatalities out of the 25. Most fatalities and most snake bites were caused by the saw-scaled viper, Icus coloratus. When it comes to seasonality again, Icus coloratus, most of the cases, they were observed during April as well as November. We have very nice variation in the weather in Jordan. In the mountains, you have snow during January, February. At the same time, if you just go travel 50 kilometers, you go to the Jordan Valley where the temperature will be 27, 28. So people in the Jordan Valley are exposed to snake bites more than anybody else because always the weather is warm. So that's why you have November cases in the Jordan Valley, as well as in January. When it comes to the Palestine viper, we have it in February till November and with a peak in June. Now, when talking about the affected body parts, we have the hands were the most affected parts. We have 30 cases in the right hand, 27 males, 3 females. The left hand, 2 males, 1 female. And then on the legs, we have 11 on the right leg. You have 23 on the left leg. You have the fingers. You have the right arm as well as the ankle, as well as in the face or the shoulder. You know, I want to imagine how somebody is being bitten in the face. I couldn't understand.
You've got 5 minutes left, just to
Mm.
indicate, yes.
Again, as my colleague just talked about, the duration of hospitalization range from 1 day to 36 days in some cases. We have two examples, two patients bitten by Echis coloratus, and the boy Palestina requires 36 and 30 days respectively in the hospital. Now, very quickly, let's give you an overview of the clinical symptoms when it comes to the boy Palestina. We have local cytotoxicity. It was seen in 93% of the cases. You have angioderma. Also, we saw it only just in one case. Non-specific systemic symptoms, drowsiness, confusion, etc., was seen in about 32% of the patients. And when it comes to other symptoms, you have hemotoxicity, and you can see here these patients with angioderma here. This guy, he was playing with a snake, and the snake just while he was holding it, it bit him in his shoulder, and he was about to die actually, and there was medical intervention. He stayed for about 1 month in the hospital. Abdominal pain, etc., and then all of the patients, they receive the VINs. By the way, in government hospitals, army hospitals, the antivenom is for free. They don't charge anything for it, and even the stay in the hospital. Again, for the boy Palestina, you can see progress on one patient bitten in his ankle, and then how the recovery is finally reached. Echis coloratus, this is the worst of all. We have 68 cases, and just very briefly, we have local envenoming with manifestation in the facial laryngeal edema causing obstruction of the airways can be seen. And you can see the variation in the outside symptoms, where you have hemorrhage in the gum, you have swelling in the different forms. And what else? The most important thing is the nephrotoxicity. Out of the 68 patients, 2, they have renal failure that requires what you call it, dialysis all forever, because there was a delay in the treatment. Macrovibral hepatina, this is the second case in the literature talking about symptoms associated with macrovibral hepatitis. So you can see he was bitten on his leg here, and then it progressed all over the leg. This patient, he stayed for 12 days because we don't have antivenoms for this one. Pseudoceratosis fildi, we have only 2 cases, and the symptoms were very mild. They did not require that much medical intervention. And from the literature, because the LD50 for Pseudoceratosis fildi, it's very high compared with other species in our area. Walternigia aegyptia, the Egyptian cobra, again, the venom is mostly neurotoxic, and we came across a few cases, and only one case we have detailed history that I can give you the history if you like in my paper. This is the one, Atrachaspis ingidensis. It is around the Dead Sea area. So any of you who want to come to Jordan and go to the resorts in the Dead Sea area, be careful about the Atrachaspis. It will not come to the hotel, don't worry. It will be in the mountains around the hotel. So again, we have 4 cases. Always, we didn't have any fatalities, by the way, but it is the necrotic effect. And in many cases, as you can see here, I didn't put the image here. The patient here, finally, they have to amputate his finger after 4 days of the infection. What I want to reach here, we have a problem in Jordan. The snake bite is a problem. And by now, we established a center in the Jordan University Hospital for toxins and animal bites and snake bites, scorpion stings. And there's a large number of cases. It is on the increase. The thing is, what I want to tell you here, that we have limitation in our study because it is retrospective, and sometimes, in most cases, examination of the records was not available as much as we want to be. The most important event happened here. We are using the VINs, and VINs seems to be not the specific antivenom that is used. And this was shown in the cases of ECAS in particular, because we have 6 cases of people that they lost their lives because using this antivenom, as well as for the other species like Macrovipera, as well as the Palestinian viper. Time at last. I have been fighting with the Minister of Health for more than 20 years. After I showed them this, they were convinced that, yes, we have to find another antivenom because this is not specific. So locally, we have in Saudi Arabia, they have a center for the National Guard, and they are producing antivenom, especially for the saw-scaled viper. So now both the Royal Medical Services, the Army, as well as the government, the Minister of Health, now they start to purchase and stock the Saudi antivenom. Anybody who is interested, I can give me his email and I will send you the paper with more details. And thank you very much.
Thank you very much, Professor Amr. We've got time maybe for 1 or 2 questions maximum, but I know it's an interesting topic, so yeah, let's speak a bit.
Thank you. Can you just give some perspective on the difference between the snake bite problem and scorpion and venomings in Jordan? What's the relative
Sure.
abundance and severity?
Sure. We have reported about 2,000 cases of scorpion stings annually. Okay. But the thing is, the mortality rate is very low, especially among adults. We came across just maybe within the past 5 years, 6 or 7 cases of fatalities due to scorpion stings among children. But when you talk about adults, no, we don't have this problem. Comparatively with the snake bites, so you are talking about what? 27 months, let's say 2 years. 2 years, we have, on this study, we have 120 cases. This should be 500 cases. And there are some cases we are not aware of. So I will multiply our data by 5. So you have at least 30 fatalities annually, and you have about 1,750 cases of snake bites every year. Yes.
Any other question or comments? Anybody from the colleagues online? If anybody wants to speak up to ask a question.
Just a minor question, Julian. Great talk, Dr. Zuhair.
Thank you.
I wanted to say, how effective are the Saudi National Guard antivenoms, and have they undergone rigorous assessments? And also, how do they compare with other antivenoms? And I wondered whether you've explored paraspecificity from any of the traditional Echis antivenoms, either the Echis ocellatus or the other antivenoms from Asia, from India in particular. Thank you. Over.
Thank you. In our area, we have Echis coloratus, and this is found in Saudi Arabia, especially the western part of Saudi Arabia, along the mountains of the Red Sea. So it's very much shared with what we have, and morphologically, and also as well as based on molecular evidence, it is almost the same species. Also, they provide the polyvalent antivenom. They have also the Walternigia aegyptia, which also shared. They have the Cerasus gaspereti, also it is shared. So what is missing, we don't have for Macrovipera libatinus, we don't have an antivenom because the Saudi, they don't produce this. Also, they don't produce the antivenom for the Palestine viper. So it is very effective, and this is shown in several publications by Saudi authors, how the recovery of patients receiving the antivenom produced by the National Guard, and it gave very, very good protection, and almost there are no more fatalities due to snake bites in Saudi Arabia by these species.
Okay, thank you. Thank you very much for the talk. Now we have a coffee break for 10 minutes or something like that, and we move to the next session. Thank you.